I recognize the member from Oshawa.
Thank you very much, Speaker, and I'm glad to be able to add a few comments in this debate on a motion that is healthcare is not for sale, or excuse me, the Private Members Bill, Healthcare is Not for Sale Act. This is about unfair fees being charged to patients, but some of the conversations that we've not only had this afternoon, but were had this morning when I know that the member from Nickel Belt had posed this question to the minister, and the minister, and I'm not even close to paraphrasing, but my takeaway was the minister was kind of making it seem like, oh, this isn't happening, everything is fine here, nothing to see in Ontario. But this is happening, and it's happening in a lot of really ugly ways. I will pick up actually just from where we had heard the parliamentary assistant to the Minister of Health talking about those who are making choices, and if they choose to pay for something along their healthcare journey, then that's their choice. But if they didn't have a choice, that if they feel they require protections, then she was giving a website and a phone number. Well, we want people to be able to, get redress for things that have gone awry, but at the same time, for seniors in our community or for folks in the community, those with language barriers or seniors or just folks who trust their doctors, which is most people, they don't know when it's a choice. If a doctor says to them, oh, I would recommend this, this lens for your cataract procedure, they're going to listen to that doctor. If the doctor says, I'm going to recommend this lens, would you like this lens? They're going to nod and say, oh, my doctor wants me to have this, I'll take it. Their doctor isn't saying, but it's not covered by OHIP. There is one that's covered by OHIP, but this expensive one, I'm going to assume that there's something in it for the doctor. So I would say that's not a choice if they don't know, right? And trusting a doctor, I don't know that I would have the agency to say to a doctor who says, you should have this thing, I recommend this. I don't know that I would say, oh, are you sure? I don't think so, because I don't know, right? If the doctor says to a patient, I need to remeasure your eye before, we measured it last week and now I need to remeasure it before your surgery, I don't know that I would say, I don't know that you do. You know, my grandma who's 101, is she going to be able to say, well, I've had the eye for 101 years, it's probably the same size? You're going to you're going to assume that the doctor is making a recommendation based on something medical, not something financial, frankly, right? And this is in healthcare, and I'm not sure what nerve I touched over there, but I think it's a fair comment that people trust their doctors, and if we're hearing, if folks like the value for money audit on outpatient surgeries outlined a lot of ugly things and problems. And so I do hope that the minister, and I do hope the parliamentary assistant, and I do hope the government takes a look at those things and says, okay, are we seeing a theme here? Is there a problem? Because we're talking about the need to stop privatizing healthcare. And for the folks at home, publicly funded does not equal publicly delivered. So all of us, the minister loves to say, and the government members are going to defend themselves by saying, oh, don't worry, you'll always pay with your OHIP card, never your credit card. Fine, but that money all goes into that public bucket, right? Like, we're all publicly paying for something, but when you have different private profit takers pulling that money out that goes to profit margins instead of better outcomes, that's what we mean when we say we want to keep healthcare publicly delivered, so that the benefits stay in the system and not going to the profit margins. And again, I don't know the nerve that I'm hitting over there. I don't know how what I said was arguable, but anyway, and there's the ideological divide, I guess. I want better outcomes for Ontarians, and they want better profit margins for folks and friends, I guess. But the power imbalance requires, has a need for strong oversight. People, especially seniors or folks with a language barrier, they're not going to argue with their doctor when there's something recommended that they think is going to be covered by OHIP and is not. I've got an email here that I will read. It's a letter from Don LeBlanc, who said, Hello, I hope all is well with you and your family. I had to see my doctor because I was having trouble with my feet, ankles, and my balance, dizziness. I got my mail today, and in it is a bill from Alpha Laboratories for $30, dated November 9th. I'm at a point where I do not have $30 to spare for anything. Last Friday, I had to put down my elder cat. She had a liver issue at 17 years old. This has taken a toll on me and Onyx. Luckily, the expense was covered by the Farley Foundation. Now I get a bill from the lab for my blood tests. What do I do? What if I do not pay it? If I was not told it would cost me out of pocket for a blood test, bad enough I had to pay a deductible for my prescriptions every year. No wonder people stop seeing their doctors. This upset me very much, just as I thought I might have the rest of this month covered, then this. I know it does not seem like much, but $30 is a big chunk of money when you do not have it. Sorry to bother you with this. I needed to vent and find out anything about this charge. Thanks. Don. Don's just a guy. And writing to his MPP to tell me about his circumstance and his cat and his family and his worries. And, you know, when piece by piece things are being taken out of the hospitals, taken out and put into private, private profits are, this is hurting real folks. Like, maybe you don't know Don, maybe you don't know other people like him, but that's where we're at. So anyway, Speaker, I've got lots more to say, but not today. Thank you.
Further debate? I recognize the member for Don Valley East.